It's Mark, M-A-R-K, Edward, E-D-W-A-R-D, M-C-H-U-G-H. Well, I was diagnosed in September of 1992. The doctor said to me, he sort of eased into all of the other tests, and then he said to me, Mr. McHugh, you did test positive for HIV. I just started banging on the steering wheel and crying hysterically. I was like, how could this have happened? I took precautions. I did what I was supposed to do. I changed my behaviors. And yet I wound up with this diagnosis. I was very frightened. There's no two ways about that. About 2 years into it, and I finally got on medications. And my T cells had gone from a little over 1,100 to just below 800. I didn't have good adherence because I was drinking so much. I would always make the morning pills because I never drank during the morning. It was the evening pills that I would miss, and I missed them frequently.
These are the people that are so ill that usually on their last regimen, what we call a salvage regimen for HIV medications, because for various reasons and various barriers in their lives that are impossible to overcome, they've burned through all their other regimens. They become resistant to them. So Pact comes in, and then depending on their level of need, we send community health workers to their homes either daily to help support them in taking their medications, or once a week to sort of help educate them about their virus, empower them, come up with plans for them for getting to their doctor's appointments, and even going with them. So what we call accompaniment, which is something that Partners in Health, it's one of the foundations of what Partners in Health does in Haiti, and it's a model that we brought over to Boston as well.
I feel much healthier. I feel much healthier, and I really couldn't have done it without my doctors or Pact. I mean, it's like you're inviting a friend over for breakfast every morning, and you chat and you get to learn more about each other, and at first it may seem like they're just watching you take your pills, like, all right, you're almost done, but it's not about that. And I realized, but while I'm talking to them, I was taking my pills, and it was automatic. I mean, it's been a godsend for me. I wholeheartedly endorse it. It's just been a lot. It's been a long, long journey, but they've made the last part of, or this part of the journey, a lot easier and a lot more scenic along the way. So I think that's been great.